Hi, and welcome to Body Beautiful. I'm Janelle Marie. Today we are talking with Dr. Joseph Mealy. He is a board-certified plastic surgeon in the San Francisco Bay Area, and we are talking this segment about liposuction. Very popular, am I right, doctor?
Very popular and useful in many parts of the body.
And can I just talk about liposuction? Now, who's coming in to get liposuction? I think a lot of people are under the impression that if you're just overweight, you can come in and liposuck the fat completely out. This is not true,
Yeah,
is
it's not a weight loss plan.
Okay.
And it's not even good for maintaining weight. It's really good for shaping when your body's close to where it needs to be.
Exactly.
So the ideal candidate is, close to their ideal weight, but has stubborn areas of fat that just don't leave, or if they're able to diet enough to make them go away, some other part of their body looks too thin or like you're not eating well.
Exactly.
So it's that healthy person, disproportionate fat.
And if you do get liposuction, a lot of people, talk, and there's myths going around that the fat just grows in some other place. I mean, is that true?
Well, if you gain weight, it goes somewhere.
Okay.
So if you've had liposuction and you gain weight, it's going somewhere.
Okay.
Usually, though, because we're removing that disproportionate fat,
Yeah.
it comes back more proportionately.
Oh, okay.
There will be some people that get it back in the same place. There will be some people where it only goes somewhere else. But
Gotcha.
most people, it comes out more proportionally.
All right, let's go to picture number one. Remember, you can see all these before and after pictures on your website, sanfranciscobreast.com, drmealy.com. So we'll get to that also. But let's go to number one, liposuction before and after. What's going on here?
So this is someone who just wasn't happy with the trunk. I mean, they didn't have extra weight elsewhere, but there were these sort of fullness in that area above the buttocks and that muffin top area
the back
and the
fat,
bra line, as well as on the belly. So what we've done is kind of trunk liposuction. We're calling 360 lipo. We're going all the way around.
Wow.
So in her case, the incisions are hidden. So there's one down sort of at the top of the fold in the buttocks.
That is
Sometimes
great.
I need to put some on the upper outer aspect of the buttocks themselves if it needs to be crisscrossed to really get all the fat out.
And for something like this, what's the downtime on a surgery like that?
So liposuction, it's like a muscle workout ache. So often people are sore for a day or two and by 3-4 days feeling fine.
And of course you do this under general
I
anesthesia.
do most of it under general, unless it's a very small focused area. I just find I need to be able to be a little vigorous at times when the fat's very stubborn. I just don't want to risk that I'm going to bother somebody. I don't want the experience to be bad. Even if we have a good result, if it's a bad experience, it's not fun.
All right, let's go to picture number two. What is happening here?
So this is someone who is concerned with the areas of the inner thigh. And we talk sometimes about that chafing. She gets some rubbing in between. But if you look at her, she's thin.
Totally.
She's not overweight at all.
Right.
It's just that area wants to gain the fat. So what we do is just a little bit of liposuction. Often in this area, I'll approach it from the front and the back to make sure we're getting it all out and getting it nice and smooth.
And you probably can't see the scars or...
The scars are very small.
Yeah.
Sometimes they'll be a little pink. Sometimes they'll turn a little brown. Often it fades with time.
It's fantastic.
But yeah, it tends to be very small.
I didn't know you could actually, I thought the thighs naturally kind of came together whether you're thin or not. And I mean, to make that space in there is amazing.
Well, it's her space. It's her anatomy. So if there are some people where the muscle just pushes it together and that we can't correct. But if it's a little bit of fat, works great.
All right, let's go to picture number three. What's going on here?
So men can get liposuction too.
Oh.
The trunk is a very common place, as is the chest. And in this case, we have someone with gynecomastia.
Oh,
He's got some fat there, but also a little bit of glandular tissue. So in his case, I've made an incision up in the armpit to hide it, where I can suction out the majority of what's there. And then I made a small incision around the areola, the little colored skin around the nipple, in order to get that firmer gynecomastia tissue out.
That after picture is amazing. Now, do a lot of men come in? Is it scary for men to come in for a surgery like this? I mean, they kind of need to know that there's help out there for them, because I'm sure a lot of men...
It's nice to know there's an option.
Yeah, exactly.
Because again, this is a guy who's in good shape otherwise.
Right,
he doesn't have a lot of extra fat on his body. It just tends to want to accumulate on his chest, and it's out of proportion. So even in a shirt, he's uncomfortable.
Exactly, and if you run or you're active, I mean, that's got to be very painful.
You can feel it moving. Yeah, it's not the best. But I do a lot of gynecomastia reduction.
Gotcha.
So I think the word's out.
The word is out, men. Don't be afraid. If it's uncomfortable, and just get it done.
Yeah.
A quick question, because a lot of people sit around, girlfriends talk, and the latest thing was cool sculpting. Now, I mean, everybody thinks that's the best thing ever. Oh, what, freeze the fat and it comes out of your body? Come on. That's
I always tell people the words new and cosmetic are not a good combination. Things like liposuction's been around a couple decades. You kind of know how it works, where it works best, and how to do it, and what the problems are and how to prevent those.
Absolutely.
With cool sculpting, we don't know yet. And it does some things sometimes that are not intended that don't give us the result we expect.
Don't go there. Stick with normal liposuction.
Yeah, no, I've had to fix a few patients that had cool sculpting with liposuction.
Oh.
So it's good to have that backup that works.
All right, our final picture. What's going on?
So this is someone who had a little bit of fat in the belly.
Yeah, not bad at
all. So often
all.
we'll get a little bit in the lower belly, a little bit on that lower back, and we'll just combine the procedure and taper it all out.
It's fantastic.
But again, it's not a weight loss issue. I mean, she'd lost weight. This stubborn fat will not go away. She just ends up looking thinner in her face.
Do you have to wear a garment afterwards for a while?
Yes. So
okay.
I do. I'm a garment person. Not everyone has you wear garments. I think they work really well. Usually have patients wear them for 2 weeks, day and night, and then half the time for another 4 weeks.
And the bruising is pretty bad, but that goes away, and I mean...
It's variable. Bruising tends to be lower than where the liposuction is done just because of, the fact that there's gravity. But we use a tumescent technique, so we're putting fluid in before, which helps decrease the bruising. I think it helps people feel better also.
All right, there you go, liposuction. Remember, you can see all these before and after photos on the website, sanfranciscobreast.com, drmealy.com, and if you want to call the office and get even more information, just call 925-943-6353. Great information. Thank you so much for joining us on Body Beautiful, Dr. Joseph Mealy. We'll see you again soon.
Always great to be here.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.